Now are going to talk about the university, Poor University, with Michael Benzaki, Pierre Buquins, Gérard Friedlander, and our moderator is Antoine Flahault. Hello, everybody. Good morning, Michael Benzaki. We're lucky to have a medical resident in public health with us who will be here to express this feeling, or he'll be the spokesman for the students in universities, and Pierre Buquins, who is a gynecologist by training, but also a professor of public health and the dean of the School of Public Health at Tulane University in New Orleans, which is one of the top 60 universities in AU, as they say. And he's also the president of the Consortium of Universities of Global Health, so with a strong focus on global health. So we're very close, Pierre. And Gérard Friedlander, who is professor of physiology, dean at the Paris Descartes Faculty of Medicine, which is also in the top 5 medical schools in France. So we have two models, really profoundly different university models. We have what we can call the European model. Perhaps the UK is slightly different, as usual. And then the North American model. The European model is a model where the registration fees are very low, and it's a public university where the state is an important stakeholder in terms of its financing. And then we have the North American model, which combines public and private, where enrollment fees are much higher, tuition fees are much higher, and financing is also profoundly different, with a culture of alumni, donors, and we will see that each university is quite different depending on the American state as well. So France has adopted the European model with extremely low tuition fees. How can we finance this university? So let's hear from Gérard Friedlander to hear what is his opinion of this status. People always say that higher education should be at the heart today of our priorities on the national level. The state should be really committed and create independent universities. And now that you're independent, why are you complaining? There have been these excellence initiatives. A lot of efforts have been made. What more can you ask, Gérard, from the state? Well, thank you. The university, I don't know if it's poor, but it does cost money, that's certain. And those who are in the university do have the impression of a certain frustration and a lack of freedom. So let me react to this last assertion, which is to say, well, you just said, well, the universities are independent. What are they complaining about? Well, they're independent, but what is their margin of maneuver? Their margin of maneuver is very slight, because they don't have the capacity to orient, and I won't use the word select, but to orient their students, nor can they set their own tuition fees, nor can they apply a proactive policy to develop their research. Often we talk about university real estate. Now, take two universities that know each other well in Paris, that are traditionally in competition with each other: Paris Descartes, my university, and the University Pierre and Marie Curie. Now, the University Pierre and Marie Curie has just received, not acquired, the full ownership of some 100,000 square meters, which is the Jussieu campus, entirely renovated thanks to the French state, thanks to what they call the campus plan, thanks to considerable investments of several billion euros. And so now this university has brand new facilities. Now look at my university, Paris Descartes. The different medical school sites are in a condition that you can't even imagine. I suggest that you go and take photos. Otherwise, you won't believe it. We have a pharmacy unit that's collapsing, and our real estate is pathetic. And this participates in inequality. And when the university has has assets in very poor conditions, there's no partnership to finance any renovation. The money only comes from the state. So yes, I'm all for an independent university and the law on the independence of our universities. Those who passed that law didn't finish the job. In other words, we need to finish the job by saying, okay, today we're trying to enlarge the scope with what we call communities of universities and establishments. These are kind of complex inventions and hard to manage. And then you have the political science or Oriental language faculties, and then other universities that don't have the same rules, that don't play on the same playing ground. And so it's unfair. So let's finish the job. That's one of the recommendations that I would like to make at the end of this debate. Thank you, Gérard. Now, let's talk about the totally opposite model, because the University of Tulane is 100% private. I don't even know whether you have any money from the state or any new buildings that could be contributed by the public authorities. So how do you work with a 100% private university? Well, we complain also. We complain. Believe you me. My colleagues spend their time complaining about research credits that they haven't received, that haven't continued to increase as in the past. The students complain about the debt that they're going to have to accumulate with their student loans. And the university presidents complain that the donors aren't generous enough. But I, who see this from a European standpoint, I think we're really in a very good position. As dean, the financing of research, which is mainly federal in America and central, it depends on the dynamics of the researchers that I must go and recruit from other universities in order to have a really effective team, and that I need to retain, otherwise they'll go elsewhere. It's the financing is given to the researchers, but it is public federal money in America, and the university has about 50% of it. So we have that represents a significant financing of the infrastructure and the overhead costs if we want to remain competitive, because maybe in the future the professors will no longer receive these research credits or they leave, and then all of a sudden we'll be in a difficult situation. So it's not something stable, but that's good, because that means that very rapidly we can build these excellence centers by recruiting the highest performing researchers to receive these federal funds. And then in terms of tuition fees, in my faculty, some students have a scholarship, but the large majority have a loan, a student loan from the National Education Authority in America, which allows them to have access to these loans, and they will repay when they have a job. And then if they don't find a job, they will have a grace period. So this can be for a PhD minimum $200,000 plus the expenses. So it's the equivalent to the price of a house. So, but the loan is guaranteed by the state. You don't need to have a rich mother or father to be able to borrow. No, for professional studies. In the 4 first years, part of the tuition fees are guaranteed by the state, and others are private loans. So sometimes there may be more differences. But when you get to the level of my world, the master's and the PhD students, there's a complete access to a loan with a system that allows a lot of flexibility, a lot of choice also, because you can choose a public university that will be cheaper and often excellent. Sometimes it's difficult to apply if you're not from the state itself, or you can choose a more expensive university, but you will have a higher loan to repay afterwards. But it does allow you to survive if you haven't found a job and the economy is slow. It really encourages you to study because the loan also covers your basic living costs. So it is a system of sort of modified unemployment that gives you benefits that you then have to repay when you're finished your training. And then the third source is donors to the university. And if we've been very generous with them, giving them scholarships in the past, and if they didn't have to have such a large level of debt when they graduated, often as alumni they become very generous afterwards. We'll come back to these alumni donors. Often they are former students of your university. Yes, very often, who are the most often the donors. And we'll come back to that. Now, I wanted to ask Michael, isn't there a certain hypocrisy in this model that we call the European or French model with so-called free tuition fees, especially in the healthcare, in the medical sector, where we feel that those who succeed are the ones who bypass the public system and actually have private classes in parallel that their parents pay for, which are almost the only solution today to have to access medical school and the internship exam after that. What's your opinion on that? Well, thank you for having invited me. I'm a student for a few more weeks, a few more days, just a few more weeks, and then I won't be a student anymore. But I am a bit afraid to have a dean of a medical school who said, I don't dare talk about selection. But if a dean of a medical school doesn't dare talk about selection, that's a bit dangerous. I would be delighted to talk about selection, actually. But when we see this merit debate with university presidents to select people at the master's level, and ministers don't want to talk about selection, they only want to talk about orientation, I think that's completely hypocritical and unbelievable. What are we afraid of? What are the red lines? What are the limits? Are we afraid of the student organizations, the unions? Well, there are no student unions. There are some among the medical residents, but are we afraid of UNEF? How many students are actually members of UNEF? 0.8% of the students are members of the student union, UNEF. So what really frightens us?
What frightens us is not the UNEF, the students' union. It's the fear that we can have, the fear of politicians that they won't reach the end. They fear that there'll be a student movement, the 0.8% of students, that's several thousand students, but it's less than 1% of the students. Well, we have these experiences in France, Canada, Great Britain, where students start to go down into the streets to protest if the fees are raised. I'm not saying don't be afraid like John Paul II. I think that at a certain point, and we've seen this on the law on work in France, it was the war of insiders against the outsiders. Those who had diplomas said, let's not reform, it will not shift the labor market. So that was the first point. The second point concerns the financing of universities. And in France, 90% is state financed. We can talk about registration fees. When I was student vice president of the Paris Diderot, and I was in favor of increasing the registration fees for students. But then you have to see the risk-benefit cost. If you look at the proportion of the registration fees of students for the total budget, it only represents 2% of the budget. So the political choice is to say, if we increase registration, we'll only be impacting 2% of the revenue of the university. So why is it worth it? In France, it's more than 90%. In Great Britain, it's 40% state financing. So we have to ask ourselves the question, how can we find a balance for this? We have to try to balance the state budget, and how do we find additional financing? Either we increase taxes, and that's probably not a very popular thing to do. What else could we do? We could sell some shares in public companies. We sell 2 or 3% of the public shareholding of a company to increase the budget. We could increase the registration fees. Will the students have to advance these fees? There's been experimentation on this. This has been done in the U.S. Was it me? Very intelligent people have thought about this. There has to be a private bank or a public bank that that begins the financing, and then when you have a master's degree, you earn 30 to 40% more than a person without a diploma does. So it's an investment in the future, and we could help pay, and then, yes, through guaranteed loans. And so there exist financing mechanisms. We shouldn't be afraid of them. We should be innovative if we want to be a driver. Some of the top 10, top 100 universities across the world do this. You have to dare to do certain things. Gérard, you wanted to comment on this and talk about researchers. Why can't we have research money like in Tulane? Well, we're not going to spend all of the debate on the registration fees, but we're in a system that is pseudo-egalitarian and incredibly unfair. The paradox is the following one. In many medical faculties of the universities, a great portion of the students come from high-income families, highly educated families. Even if the trend is changing a bit, we're seeing more modest families that are seeing their kids join the medical faculty. But 250 euros as registration fees per year in the U.S. and $62,000 for the Harvard Medical School. So perhaps there are intermediate solutions. There's middle ground to be found. So I'm throwing out a random figure, maybe 1,000 euros per year per student. And for most families that register their kids, they wouldn't see the real difference. But it would be possible to set up a fund for bursaries. And there are bursaries that are given to some students. The bursaries make it possible to survive. So in the end, the students don't owe us anything, and since they don't owe us anything, they're not giving us anything. And that's a major problem. So the alumni, you mean donations? No. There is no alumni culture in the universities. It does exist in business schools and the grandes écoles, and maybe Paris Dauphine, that has a different status. But for us, it's very hard to create this alumni culture that doesn't exist in any medical faculty in France. When a master's student has $100,000 of loans at the end, half of that concerns the registration. The other half, the other 50,000, are to live on for roughly a year and a half during the master's program, to buy books, computers, to pay fees. This is guaranteed by the state Office for Education. It's the equivalent of the Ministry of Education in the U.S., guaranteed by Obama. So it allows students to live decently, and it also allows you, while you're looking for a job, to take that option so you have a better training, and you're able to live decently for that during that time. So it also means that some students have a hard time actually moving on and graduating. I have to push them because my accreditation system I need 85% of my students to graduate on time to keep my accreditation, so I can't have too many of them staying in the system for too long, because these guaranteed loans, state guaranteed loans that allow them to live decently, can become a lifestyle that some people want to maintain. So there are some ideas around registration fees that doesn't seem to be a red line to the representative of the student union here. I think he's saying it just requires some political courage. Let's talk about this, one of the other pillars of university. That's research that finances universities. We have some very good researchers. We're in honorable positions in health research, particularly. But research isn't only at universities, it's also at the CNRS and the INSERM, the French National Research Institute. Well, there are 2 points. Firstly, let's stay limited in the field of health. We're given 3 assignments: health, care, teaching, and research. So for the general public, the healthcare takes place in the hospital, and the hospital in their eyes isn't the university, but these are mostly university hospital centers. And so the university is in the hospital de facto, but for the general public, this isn't clear. Secondly, research often takes place at the INSERM or the CNRS, the national research organizations. So basically, for the university, they're left with the task of teaching. And that's an incredible paradox. Higher education is fed essentially from research, and you can only have good quality, higher level education if it's fed by research. The hospital research workers do research, and in the health field, there's a screen, there's a separation in the mind of the general public. For them, research takes place at the INSERM. So even if we try to say that they're units, that the labs are mixed units for research, university research and the INSERM, where somehow people forget the university aspect of the lab, and people only remember the National Research Institute being involved. And that's unfair, because the university pays part of the wages of the researchers working in these research labs. And if I look at the institute that I work in, that I helped create, I would say that the wages are distributed 1/3 paid by the university, 1/3 paid by the INSERM, and 1/3 paid by us. And in terms of the operating budget, what do you mean by us? The money that we get through contracts and research. So we, the researchers, be INSERM or university researchers. But the university doesn't really contribute to the operating budget of the lab. INSERM does a bit, but these 2 recurring funds for the average biology lab represents 15% of the total operating budget. So 85% of the budget is something that I have to find through partnerships. Let me just stop you for a second. I'd like to ask Pierre. I think the NIH works the same way. In the US, they finance research. Yes, but it doesn't cover more than 10 to 20% of the budget. So 80% of the 35 billion of financing at the NIH goes to universities. If you go to Bethesda, it's big, but it's not huge. The centralized labs of the NIH are limited in terms of their expenditures. And the money is distributed to the universities throughout the country. So the legislators of the different states have to support this budget, so that it has to go through the states. It's really decentralized. And this decentralization is what makes American university is very dynamic in terms of research. And it's not just assistance to universities, it's a completely dynamic system, as I said. It allows me in Tulane to say that tomorrow I want to be number one in tropical diseases, and for that I'm going to go look for the best researchers who are going to bring the NIH money to my lab. And if I'm not effective, they'll go elsewhere. So I have to fight for that. But this decentralization, the fact that there aren't more than 20% of the budget going to the university labs, it makes it that so that we have to really be very dynamic in looking for financing. So do you think the French law on the autonomy of universities didn't go far enough? Gérard, would you like to see this at the INSERM and see INSERM turned into a national research agency, so not have intramuros study programs, but rather NIH-style programs? Well, naively, I thought we were at the beginning of a process when the law of the autonomy of universities passed, and that we would see the cursor move more and more towards the universities with what you say, with the recentering of the INSERM as an agency that would distribute resources. But this is not what we've seen in the last 5 years. The INSERM is very dynamic, that's good, and a bit too hegemonic. The law on universities did not reach the full extent of its possibilities. You talked about the way you attract your researchers and your professors in the U.S. We can agree or not agree, but there's a system where the best get selected, what we call a mercato in French. So the postdocs here are very cynical. They send it to Paris, Barcelona, Zurich, Heidelberg, Berlin. And I'm focusing on Europe voluntarily. And what do they ask for? How much are you going to pay me? What facilities will I have? What's the welcome package? And we lose systematically because we say we don't have the means to negotiate wages. A professor earns the same thing in France, regardless of the discipline. There's the point of the hospital and university professors, but we don't negotiate the contracts of our researchers and professors on a university-by-university basis. This can be quite limiting, and I know to try to attract young people to the university world, we are losing a lot of brilliant young people because we can't line ourselves up financially with other European institutes. There's the INRIA, which is for math and computing, the Research Institute for Math and Computing. They negotiated with the unions and the state that the positions would not be civil servant positions, because the low wages are also because they're civil servants. We're guaranteeing them a job for life. So these are contracts that they're proposing at the INRIA, so with twice the wages, but for a limited time, maximum 6 years. And they realized that a lot of Koreans and a lot of North Americans and China were applying because they didn't want to be civil servants for life. They wanted to be earning twice as much money. And I think, do you think that this could be considered at the INSERM? Well, there's a societal debate that's going on in the US and not in France. This is the debate around tenure, about the position for life. And so they want to limit this in the US now, and we're not even asking ourselves the question as to whether in France we could imagine this position or working conditions between I enter the civil service in 35 and I leave at 65. For a very small number of people who enter, it's a rather securing, and they continue to work in this field. But for other people, it's completely demotivating. So really, we're at the end of the end of the end of the status that was proposed to us in the law of 1958. And I'm talking about hospitals and the way that we're trying to bring doctors back into the public sector. So it's up to us to invent, and very rapidly invent, a new way of operating. So, Michael, I'm going to hand the floor to you, but I'd like to talk to the dean. You talked to the dean about the selection, but you didn't answer the question about the parallel teaching. Those who succeed are those who pay in medical school. They go to 2 schools in their first year. Well, the university doesn't do the job properly. It's as clear as that. If private companies are growing and all the students are going to them, it's because at a given moment the university is not doing their job properly. I have a conflict of interest here. I lecture to prepare students. I can say it without any problem in a private organization. So the university is not doing the job properly. So maybe at Descartes it works well. Yes, right now the publishers are trying to buy our prep year conferences that we do every Saturday morning. Paris Descartes isn't France. So elsewhere in France, it's not working so well. Yes, and I regret that. But what I want to say is that it's starting to happen. It's starting to occur. Even those who don't have the financial resources, when you're in first year of medicine, where only 10% of the students are selected into second year, they pay anyway, and it puts them in very difficult positions where we have students who are in disastrous situations, who are living in tiny flats, less than 10 square meters. They have no income, but they're still paying for this additional tutoring. There are initiatives that are starting to be taken in the universities to compete with the private companies. Well, what's free has no value in the end. Well, you could look at it that way. I don't know what you're trying to say by that, what's free has no value. If we're well trained and we can move up in terms of the results and move into second year, that has a value. Well, do you think universities are poorly considered because they're free? They're the grandes écoles that are expensive and people go to them, and the American universities are expensive and the students there aren't having to go to parallel schools. Maybe our universities are not properly considered or respected. Well, from a philosophical point of view, I could agree with you, but maybe we need to add some psychoanalysis to this. We are here together. Maybe what's free has no value for the students, but I don't think that we're really in that perception. I think that the students are there to really get the best ranking in first year, to succeed, and also in sixth year when there's another ranking that's very important for their intern years. So I'd like to talk about research and the lifelong employment. There are some supposedly research-focused universities and others less. Research is 35% on average of the university's budget. And the difficulty is to create connections between private companies and the universities. The only vision, and I remember when we were allowed to create university foundations to get private subsidies from companies, the only ideas were saying we've got to go see the top 40 companies in France. No, there are lots of local companies, startups, SMEs that need these graduating students and that maybe have a different vision. And so this local entrepreneurial ecosystem has to be exploited. The second point about the financing of the foundations, all of these foundations were a big failure in France. The university foundations. We said we would open up foundations and we'll get billions of euros in, like in the US. We can make Paris Descartes the new Harvard, but it didn't happen. And it's slower than we had expected. Yes, we see that the deans know how to get the message across. Well, I think after 5 years, it's a failure. We talked about alumni. We don't owe anything to the university. I was the vice president of the student council, and I said we need to have T-shirts with, say, Paris Diderot, T-shirts, a mug, but people don't feel like they belong. They weren't interested at Harvard. They've got Harvard on everything. The French students who don't go to Harvard all wear Harvard T-shirts. So we really have to wonder about the identity that we have and as students in universities. We tried to create communities in the universities. We tried to develop the identity of the universities, and it didn't work. I think regrouping the universities is a good solution, but it dilutes their identity even more. And the students are saying, okay, I went to Paris Diderot, but then I went to 4 years to the university in Reims. I was an intern in Reims, so we're lacking this identity. We're just at university, if you like. And I'd like to conclude with the jobs for life. Stop it already. That doesn't interest us. We don't care. That's not our world. It's actually frightening to say, I'm going to stay at the same place from 30 years to 70 years. That terrifies me. Well, it doesn't hurt, though. Well, maybe you get bed sores after a while, though. I don't agree with you. I don't agree. I really defend the tenure in the U.S., the employment for life, but that doesn't mean wages for life. But that's different. It's different. In Tulane, we guarantee 50% of the wages. The other 50% are flexible and depend on successes in terms of research contracts. In certain universities, public universities, tenure means that you're a civil servant for the country and you have a contract. This sometimes leads to problems in terms of rigidity, but in many places, it's a contract between the university and the professor that's very important. The academic freedom is something that needs to be defended. And the system of contracts for life doesn't mean the same wages for life, and it doesn't mean the same wages for everybody. There are huge differences in terms of wages between the best professors. Well, that's a huge difference with our system, yes, but regardless of what you see, what you think, you're not going to be let go from one day to the next. That's very important to know that you have some security. There wouldn't be Marxist professors of economics in the U.S. if there wasn't tenure, and I think it's important that all of these ideas be allowed. I'm maybe a bit traditional. I think that contracts for life are good, but not the salaries for life. I don't want you to think that think it's a great idea to have contracts with 0 working hours. That's not what I'm in favor of at all. I think we're saying in a caricatural way that this contract leads to inequality. I think that these contracts are good ideas in terms of realism, acceptability, and motivation. Let me just talk about the last assignment of the university that we didn't talk about, and that is teaching. It's preparing the internship is part of that, but it's not only that. I'm struck by the fact that we're supposed to change our teaching methods, have them evolve. That's to find a fit between the way the students live in their everyday lives and what they receive as a type of teaching at the university. We can't ask them to have their cell phones in their hands constantly, because that's how they live in their everyday life, and then say you have to sit for an hour and a half in an amphitheater with some guy standing in front of you and all these 300 students listening. Well, of course they can still send text messages and be on WhatsApp, but it doesn't work. And we're being asked to make this effort to modernize to maybe digitalize the teaching process. Maybe Antoine could talk about this better than I can. It's obvious that we need to do something like this, but it's very expensive, and it will only be possible if we have partnerships. That's very important, because what we know how to sell as a university, as the Faculty of Medicine, is our pedagogical know-how, and that's what we do. In my faculty, my only income comes from teaching the third cycle and for continuous training. The university does not give me a cent for my operating budget. So the better we are in terms of our teaching methods, the more we improve, the more we'll be able to sell them in terms of partnerships, and the better off we'll be. Innovating teaching experiences, I think of the interdisciplinary research centers, these pedagogical labs that exist here and there. It's great at a small scale. But we need to still prove that it's feasible with classes of 450 students. And that's the case in my university. So this scaling, as we said in the previous roundtable, still has to be examined and challenged. In Tulane, do you use MOOCs in your program? No, but we do a lot of digital programs, a lot of reverse teaching where we work digitally prior to getting into the classroom. And in the classroom, it's only interaction. And for the medical students, do the interns use this type of parallel and free training online? With the previous internship sixth-year program, this was computerized. Everything is on a tablet. So the way of learning is changing now with online teaching, with conferences online, lectures online, and the universities are doing this. We have our lectures online. There are exchanges via platforms with professors who are starting to use this new method of communication, and students are looking for other sources on the internet too. Internet is very rich. You put on your telephone in the metro in Paris your lecture from your university, which is online, and you can get you can listen to your lecture on the subway on your way to the university or to work every day. And we adapt, and I think that the students could be drivers, push the university to adapt and to use these new technologies. And sometimes it's a little bit complicated. Well, thank you to the three of you. I think Michael gave a nice conclusion. So for the university, there is a lot of hope. And enjoy your coffee break now. Thank you.